Blind Spots opens with a powerful exploration of the hidden layers within healthcare, inviting us to look beyond what we often take for granted. Makary begins by diving into the world of patient experiences, shedding light on the unseen risks patients encounter in medical environments. He shares poignant stories of individuals who entered the healthcare system with trust, only to face unexpected consequences due to oversight or lack of transparency. These stories reveal how easily blind spots in communication, treatment options, and patient advocacy can create profound impacts, leaving patients vulnerable and, at times, struggling with outcomes they never anticipated. Makary also examines the often invisible dynamics between medical professionals themselves. He highlights how, even in a world governed by rigorous training and ethics, there are divides that affect patient care, such as communication barriers between departments, biases in decision-making, and a hesitancy among professionals to question practices they see as subpar. By weaving these intricate dynamics into his analysis, Makary reveals the internal battles healthcare workers face and emphasizes the urgent need for stronger advocacy and teamwork to improve outcomes. Makary delves deeper into the internal divides by examining how hierarchies within hospitals and clinics can stifle open communication, with junior staff often feeling unable to raise concerns or question senior decisions, even when patient safety is at stake. This hierarchy, he argues, creates an environment where professionals may follow orders out of obligation rather than conviction, prioritizing protocol over proactive care. These silent barriers not only impact patient outcomes, but also add to the emotional burden healthcare professionals bear as they struggle between following authority and advocating for what they believe is best for their patients. One example Makary shares is the case of a nurse who identified a dosage error in a patient's medication, but hesitated to speak up, fearing backlash from her supervising physician. By the time she reported it, the patient had already experienced adverse effects. This incident highlights how a culture of hierarchy and fear within medical teams can directly impact patient safety, as healthcare staff may hold back critical observations to avoid conflict or repercussions. In addition to hierarchy, Makary highlights the issue of burnout among healthcare workers, a condition that often goes unnoticed yet severely impacts decision-making, empathy, and attentiveness. Long shifts, high-stress environments, and the sheer volume of patients can leave doctors and nurses physically and mentally exhausted. This burnout often results in higher rates of mistakes, miscommunication, and even detachment from patients. Makary argues that a healthcare system driven by profit often overlooks the well-being of its staff, failing to address the root causes of this fatigue. One example is the case of a major hospital chain that prioritized increasing patient volume and profitability over adequate staffing levels. To maximize profits, the hospital reduced the number of nurses on staff during peak hours, expecting remaining nurses to manage larger patient loads. As a result, nurses became overwhelmed, leading to high levels of stress and burnout. In one incident, a nurse reported feeling unable to provide proper care due to the excessive workload, resulting in delayed patient responses and increased medication errors. This situation not only compromised patient safety, but also contributed to high turnover rates among nursing staff, demonstrating how a focus on profit can detrimentally affect both employee well-being and patient care quality. Makary suggests that investing in the well-being of healthcare professionals through manageable shifts, mental health support, and an environment that fosters openness and respect can be transformative. By taking care of those who care for others, the system can function more efficiently, with professionals who are both able and willing to bring their best selves to their work. Continuing his journey, Makary tackles one of the most pressing issues, the transparency, or lack thereof, in patient data and outcomes. He argues that while patients assume their providers have access to all relevant information, the reality is more complicated. Inconsistent access to past records, unclear guidelines, and data silos across hospitals create additional blind spots. These barriers, he explains, often lead to redundant tests, delays in diagnosis, and sometimes even inappropriate treatments, all of which could be mitigated by a more connected healthcare system. A real-life example Makary provides involves a patient who moved to a new city and visited a local hospital for a routine checkup. Unaware of her full medical history due to data silos and incompatible systems, the doctors missed critical information about a prior heart condition. This lack of transparency and access to her records led to an incomplete assessment, which delayed essential treatment when her symptoms escalated. This incident underscores how disconnected health systems can put patients at risk, as critical health details fall through the cracks when records don't seamlessly follow patients across facilities. Makary proposes that by creating a system where records and relevant health data flow freely and securely between practitioners, not only would patient care improve, but the unnecessary financial burdens that often accompany redundant procedures could be drastically reduced. Another key element Makary investigates is the role of healthcare costs and insurance limitations in shaping patient care. He brings forward the struggles of patients who find themselves paying exorbitant fees for routine care or treatment plans dictated more by insurance policies than medical necessity. The high cost of basic procedures, coupled with opaque pricing structures, often creates a dilemma for patients who must choose between their financial stability and their health. One example Makary shares is of a young woman who, after a minor car accident, was taken to the ER for a routine checkup. The hospital later billed her over $6,000 for tests and scans, even though she had insurance. She discovered that the price structure wasn't disclosed up front, leaving her with unexpected crippling debt. Faced with this financial burden, she later avoided seeking necessary follow-up care, highlighting how opaque pricing can deter patients from pursuing essential medical attention when they need it most. Makary advocates for transparent, fair pricing that respects patients' need for affordable health care without compromising quality, drawing attention to how these changes could revolutionize trust within the system. The book also touches on the misuse of prescription drugs and the influence of pharmaceutical companies. Makary explores how, due to aggressive marketing and prescribing trends, patients are sometimes given medications they don't need, putting them at risk for dependency or unwanted side effects. He reveals how this misalignment, where profit motives override patient well-being, contributes to the blind spots affecting healthcare's integrity. Makary shares the story of an elderly man who was prescribed opioid painkillers after a minor surgery, despite his low pain level. The prescribing doctor, influenced by pharmaceutical marketing that promoted opioids as a standard post-surgical treatment, didn't consider safer alternatives. Over time, the man developed a dependency, which led to additional health complications and hospital visits. This example highlights how aggressive pharmaceutical marketing and routine overprescribing practices can put patients at risk, prioritizing profit over patient safety and well-being. By addressing these practices and suggesting tighter regulations on pharmaceutical marketing, he calls for a culture shift that prioritizes patients' health over corporate gains. This would help healthcare providers regain their role as true advocates for healing and care. In his final insights, Makary examines the future of healthcare, emphasizing that meaningful reform must come from within, fueled by ethical, transparent practices that honor both patient rights and medical standards. He urges professionals, policymakers, and patients alike to recognize and address these blind spots collaboratively. He believes that creating a sustainable healthcare system requires embracing honesty and accountability from every level, paving the way for a more humane and effective system. In exploring the future of healthcare, Makary underscores the importance of integrating technology and innovation with a patient-centered approach. He advocates for the development of platforms that promote transparency, allowing patients to access their health information easily, understand treatment options, and compare costs. By leveraging telemedicine, wearable health technologies, and data analytics, the healthcare system can empower patients to take charge of their own health, leading to informed decisions and improved outcomes. Furthermore, he highlights the need for healthcare institutions to invest in staff well-being, providing support systems that alleviate burnout and enhance job satisfaction. By fostering a culture of collaboration, respect, and continuous improvement, healthcare organizations can not only mitigate existing blind spots, but also build a foundation for a more effective, equitable, and compassionate system that prioritizes the needs of both patients and providers. Thank you so much for listening and joining us. If you enjoyed the audiobook, don't forget to like, subscribe, and hit the notification bell to stay updated with more book summaries that help you expand your mind. Drop a comment below to let us know which book you'd like us to explore next, and we'll consider it for our upcoming episodes. We look forward to bringing you more valuable content right here on Page by Page. Until next time, keep learning and growing.